Hello, my name is Nicole Goodwin. I'm sitting here today with Kylene Logorda. Between the both of us, we are going to sit through and go over a few commonly asked questions in regards to postpartum therapy. Kylene, do you want to introduce yourself first before we begin?
Sure. Hi, Nicole, and hi, everyone out there. Thanks for joining us today. We just wanted to take a couple minutes and go over, like Nicole said, a few commonly asked questions about postpartum therapy. I'm a physical therapist at St. Luke's Physical Therapy in Palmer Township, and I specialize in women's health and pelvic floor conditions.
Kylene, why would women need physical therapy after having a baby?
So during pregnancy, there's a lot of changes that occur in a woman's body that are hormonally driven, but can affect the musculoskeletal system. And specifically, our abdominal muscles become over-lengthened and our pelvic floor muscles become over-lengthened, which can lead to weakness and sometimes dysfunction. Our posture changes. So it's a really great idea to come in and have a visit with a physical therapist after having a baby so we can evaluate all of those different things related to your pregnancy and postpartum conditions.
And Kylene, what is the most common condition you treat postpartum?
So the most common condition that we treat postpartum would be urinary incontinence, which is leakage of urine, which could be like more severe and constant, or could be more like with an activity or a cough or a sneeze. And although it is common, it is not normal. So there's definitely treatment for it, and we can help with that.
Okay, great. And are there any other conditions that you see commonly that would be helpful for the viewers to learn about?
Yes, definitely. So in addition to the incontinence of urine, we also see incontinence of our bowels, and sometimes urgency, which is kind of a strong, sudden need to go to the bathroom. But also pelvic pain is pretty common after having a baby, specifically like pain with intercourse. So those are some of the common pelvic floor conditions that we see, but we also see more of orthopedic conditions like hip pain or low back pain, sometimes pelvic girdle pain or weakness. We also take a look at your abdominal muscles, like I said, because they become over lengthened. And we look at the strength and coordination of those. We also look for if there is an abdominal separation, that's called a diastasis of the rectus abdominis. So those are all things that we're commonly evaluating in a postpartum woman.
So when do you recommend a patient should first call into one of our therapy offices to speak to you, and what would their first visit look like?
Sure. So typically, like the earlier that we can get started, the better. But typically, we'll see patients anywhere from like 4 to 6 weeks postpartum. And of course, it's always dependent on the patient and the physician as well. But usually around 4 to 6 weeks. So you can kind of bring you in and do that postpartum screen. And typically during a first initial evaluation, we'll look at your posture. We look at your strength, your flexibility a little bit. Look at your body mechanics. Sometimes I'll have you imitate like how you're holding your baby or how you're doing different things related to caring for your baby. And then sometimes, if it's appropriate, we'll do the pelvic floor muscle exam, which typically will wait till 6 weeks after a vaginal delivery to do the pelvic floor exam. But we also do see patients after having a C-section as well. We evaluate the C-section incision, and we talk about scar tissue management and things like that. So that's typically what you'd expect to see during a first visit. And then we give you some exercise and instruction for self-care and things like that as well. and we talk about what to expect in your further visit so we can develop your plan.
Okay, great. What do you recommend if a patient calls in and they had their last baby delivered, say 10 years ago?
So whether you recently had a baby or you had your last baby, like you said, more than 10 years ago, it's definitely important to address some of the issues that could be a result of having children. So sometimes we have women that are a little bit older, and when we're going through their medical history and we're talking about their births or the deliveries of their children, it actually brings up some issues that maybe came from that. So I like to say postpartum is forever. So if you ever have any questions or concerns, even if it's from years past, we can definitely help with that as well.
Okay, great. I want to thank Kylene for taking the time today to answer some of these commonly asked questions. Kylene, do you have any last information or tips you want to share with the viewers?
Sure. Thank you again, Nicole, for joining me as well. And thank you to all of you out there who are joining in or listening in to us. Basically, if you have any questions or concerns, or you'd like to schedule an appointment with a women's health physical therapist, please visit our website for some more information at www.stlukesphysicaltherapy.com, or you can call 484-526-5025. Thanks so much, guys. Have a great day.
Thank you.
Thanks.